Hello, my name's Dr. Chris Spanswick. I'm one of the physicians here at the Chronic Pain Centre. And this afternoon we're going to go through understanding medical investigations and the healthcare system. So let's start. Making a diagnosis, or why does the patient hurt? This is really the background of why we do medical investigations. Why are we doing this? We're doing this to look for any underlying disease. Can we find out what the cause of the pain is? We're looking for any missed potentially harmful treatments. It may be that, that there may be some appropriate treatments that you've not had, and having an understanding of what's going on underneath, why you're suffering so much pain, will give us an idea of what other treatments may be appropriate for you. It will also help us in terms of what other treatments we might try that you haven't had before. So if we have an understanding of what's causing the pain, maybe we can direct some of our treatments at the cause of the pain. Now, to be fair, most people, by the time they reach the Chronic Pain Centre, have been pretty carefully assessed, and they've had pretty much most treatments that are appropriate. And so often we're having to look at other ways of helping people manage their pain. But nevertheless, it's still very important that we do look for underlying causes. The other thing that many patients want to know is, well, what's the future like? And having an understanding of any underlying diseases or underlying cause of the pain will enable us to give you some idea of what the future may be like. Are you going to be in pain for the rest of your life? What's the likelihood that there might be something that we can do something about? Or can we in fact cure the pain? But as I said earlier on, sometimes we just don't have a diagnosis. And you'll be quite surprised the number of times that we see patients here, maybe as many as a third or a half of patients, we're unable to pin down your pain to a very specific diagnosis. And that's a little bit scary, but that doesn't mean to say that we can't do something about your pain and that we can't help you manage it more successfully. So, a lot of the time, although we can't come up with a diagnosis, we can come up with an idea of the mechanisms, why the nervous system is behaving as it is, and why do you experience pain. And giving some idea of whether it's some chronic inflammatory condition or whether it's the way the alarm system is behaving will give us some idea of the sorts of pain treatments that might be more successful. So even though we can't come necessarily to a specific diagnosis, having an idea of the type of pain, whether it's a nerve pain, or whether it's an inflammatory pain, or whether it's a muscular pain, will give us an idea of the sort of treatments that we might be able to do that would help you more. So what tools do we use to make a diagnosis? And the most important is taking the history. I think this is something that's often forgotten by patients because it seems to be a natural part of what we do as physicians when we talk to patients. But actually it's really important for us to allow you to tell your story. What we're looking for is a pattern that we recognize, one that we've seen before. And when you see a pain physician here, you will be telling your story to somebody who has seen lots and lots of patients who have had pain that's gone on for a long time. Rather than the other physicians, with great respect, they don't see a big proportion of their patients as having chronic pain. So we collect people like you, as it were. And so we're more commonly and more likely to recognize the story as you tell it to us. And that's really very important. The physical exam is also important because the history of it often gives us a clue as to what to look for when we're doing our physical examination. And we'll be looking for specific things. We may be looking for the way the nerves are behaving, and so tapping reflexes and looking at sensation and seeing how strong muscles are, and so on and so forth. Or we may be looking for the way your body moves, the way the joints move and the way they behave in relation to others, etc. So this is another piece of the jigsaw puzzle that we're trying to pin together to give us an idea of what the bigger picture is like. The clinical history and the physical exam then often give us clues as well. We can list some things, some thoughts in our mind that, listening to the story and doing a physical exam. This could be a number of problems. It's often called a differential diagnosis. It's just a list of potential things that could be wrong. And doing some blood work may enable us to pin this down or to narrow down what the problem may be. Or it may also be used to exclude, to make sure that we haven't missed something. If we're concerned somebody's got an inflammatory arthritis, there are particular tests that we can do, and we can either rule that out or rule that in. So that's, again, another piece of the jigsaw puzzle that we're trying to pull together. Diagnostic imaging is perhaps the next important piece of the jigsaw that we're going to try and look for. I think it has a reputation that this will find the answer to everything. And we all know that when the MRI scan came out, that we were expecting this is going to find the answer to most of our problems. And as I'll tell you later on, we really need to remember that diagnostic imaging is no more than a very glorified picture. It is very good at helping us understand structure, but it doesn't necessarily tell us how things work. So you need to take the results of diagnostic imaging, whether that be X-rays or MRI scans or CT scans, into the context of the other pieces of the jigsaw that we pull together. So we're almost playing a detective game, trying to find different pieces of evidence so that we can pull this together to come together with a complete picture. I'm hoping these slides are going to work really well because I did. Yep, it does. Good. So the first one, in the clinical history, as I said, we're recognizing the pattern of pain. There are particular patterns that physicians look for that give them a clue as to what may be going on. So, you know, how it started, its relationship to something that happened. Maybe it started after surgery, maybe it started after an accident or an injury, or maybe it just crept up over a period of time, and that immediately helps us begin to categorize what sort of pain this is. Commonly, there's more than just one pain, so we need to know about all of those pains. And it's not uncommon for people to have one pain, let's say low back pain, and later on they then develop some pain higher up, maybe in the thoracic spine or maybe in the neck. And we need to know about that, and we need to know how that developed across time, because that will then, again, give us some clue as to what may be going on. Maybe it's related to posture that's been abnormal since the back pain. There are other things that are really quite important because, contrary to popular belief, you're not a pain. You're actually a person who's got pain. And we want to know not only what the pain is like, and we do ask impossible questions because pain is a very individual, subjective experience. I have no idea what anybody's pain is like. Only you know what your pain is like. So I guess what we're trying to do is put ourselves in your shoes. And the best way we can do that is, having seen lots and lots of people, we recognize those stories and say, that's one of those pains. But we also want to know, yes, the impact of pain. We want to know what it's done to you, because you're not just a pain, you're a person. And pain has a profound impact on virtually every part of people's lives. Not just on your life, but probably on the life of those around you and those that are close to you. We want to know, there we go, impact of pain. We want to know how it's limited your activity. What are the things that you can do? What are the things that you can't do? What are the problems that you have with that? What happens when you try certain things? Also, we want to know what strategies, what techniques have you been using to cope with pain? A lot of people will try and push through pain. Some people, quite a lot also, will reduce activity to try and manage their pain. But then frustration drives them to have a go at doing things again, and what happens? They wind their pain up. So we want to know what techniques you've used, because some people have innately good techniques, and some of us, myself included, don't have very good techniques for coping with pain, and we need some guidance on how to do that. And we'd like to know what this has done to both you, your family, and quite commonly your ability to work and enjoy life and do all the nice things in life. So this is really a way of getting to understand the whole picture of you with your pain and how that's affected your life.